Have you ever pondered about the silent diseases that could be threatening the health of millions around the world? One such silent global health crisis is hepatitis. It's a medical condition characterized by inflammation of the liver and often caused by a viral infection. However, it's not just one disease, but a group of diseases known as hepatitis A, B, C, D, and E. Each of these types has different causes, from consuming contaminated food and water to exposure to infected blood. The symptoms also vary, with some people showing no signs at all, while others experience fatigue, nausea, loss of appetite, and jaundice. It's a silent killer because you could have hepatitis and not even know it until it's too late. This stealthy nature makes hepatitis a significant threat to global health. Now you might be wondering, just how widespread is this silent killer? If you find this video informative, share and subscribe to our channel for more health-related content. The reach of hepatitis is far greater than we often realize. This statement is not just rhetoric, but a sobering reality. Hepatitis, in its various forms, is a global health crisis that continues to affect millions of lives. Let's start with the basics. Hepatitis is a disease that inflames the liver, and it's usually caused by a virus. There are 5 main types of the hepatitis virus: A, B, C, D, and E. Each type presents its own unique challenges and threats to global health. Now, let's talk numbers. It's estimated that a staggering 325 million people worldwide are living with chronic hepatitis B or hepatitis C. That's equivalent to the entire population of the United States. And while hepatitis affects people in every corner of the globe, certain regions bear a disproportionate burden of the disease. The Western Pacific region, for instance, is home to a significant number of hepatitis B carriers, while Eastern Europe and Central Asia are particularly affected by hepatitis C. But the impact of hepatitis goes beyond mere numbers. It's a leading cause of liver cancer and cirrhosis, resulting in 1.34 million deaths annually. That's more than HIV, AIDS, or malaria. And these are not just statistics. These are individuals, mothers, fathers, children, whose lives are cut short by this devastating disease. Moreover, hepatitis has a significant economic impact. It drains our healthcare systems and hampers productivity. It's estimated that the global economic loss due to hepatitis is in the ballpark of $6 billion annually. These costs arise from direct medical expenses, loss of income from sickness and death, and the indirect costs of managing the long-term effects of the disease. Hepatitis isn't just a health issue, it's a war on multiple fronts. It's a war against human lives, against economies, and against our collective future. And while the battle is far from over, understanding the scale of the problem is the first step towards victory. As you can see, hepatitis is not just a health issue, but an economic one too. How does hepatitis find its way into so many lives across the globe? It's a question that begs an answer, especially when we consider the staggering numbers affected by this health crisis. Hepatitis, a silent infiltrator, spreads through various channels, some of which are unfortunately commonplace in our societies. Let's start with healthcare practices. In an ideal world, every medical procedure would be safe, sterile, and strictly regulated. However, this is not always the case. In certain parts of the world, unsafe healthcare practices, such as reusing syringes or unsterilized medical equipment, are contributing significantly to the spread of hepatitis. It's a sobering thought that those seeking healing could inadvertently contract a life-threatening disease. Next, we turn our attention to unsanitary conditions. Poor sanitation and lack of clean water can expedite the transmission of hepatitis A and E, especially in regions where such basic amenities are scarce. These types of hepatitis are often linked to the consumption of contaminated food or water, making them a widespread issue in areas grappling with poor sanitation. Lastly, we can't overlook the role of unprotected sexual contact in spreading hepatitis. Hepatitis B, in particular, is a sexually transmitted infection, and unprotected sex can significantly increase the risk of contracting it. It's a stark reminder that protective measures in intimate relationships are not just about preventing unplanned pregnancies, but also about safeguarding our health. When we look at the statistics, the reality becomes clear. Millions of people worldwide are living with hepatitis, a significant portion of which was contracted through one or more of these channels. The numbers are daunting, but they also underscore the importance of addressing these issues head-on. Clearly, prevention plays a crucial role in combating the spread of hepatitis. It's a call to action for safer healthcare practices, improved sanitation, and responsible sexual behavior. After all, when it comes to our health, we can't afford to leave anything to chance. So, what can we do to protect ourselves and our loved ones from this silent killer? First and foremost, it's about knowledge. Understanding what hepatitis is, how it spreads, and how it impacts our bodies can give us the tools we need to prevent it. We need to move beyond the fear of the unknown and instead arm ourselves with knowledge. Let's talk about vaccines. Vaccines are a powerful tool in the fight against hepatitis. For hepatitis A and B, there are effective vaccines available. These vaccines are safe, affordable, and accessible. They provide long-term protection against the virus, often for life. It's important to get vaccinated, not just for our own health, but for the health of those around us. Next, we need to consider safe healthcare practices. This includes using sterile medical equipment, ensuring safe blood transfusions, and promoting rigorous hygiene protocols in healthcare settings. Healthcare professionals have a critical role to play here, but as patients, we can also ask questions and ensure that proper safety measures are in place. Safe sexual practices also play a crucial part in preventing the spread of hepatitis, particularly hepatitis B and C. This includes using protection during sex, getting regular checkups, and being open and honest with partners about health status. Regular testing is another key aspect of prevention. Early detection can lead to successful treatment and can prevent the virus from spreading to others. It's important to get tested if you think you've been exposed or if you're at risk. Lastly, we can't underestimate the power of awareness. Talking about hepatitis, spreading information, and debunking myths can help reduce the stigma associated with the disease. Knowledge is power when it comes to hepatitis. Arm yourself with it, and you can become a part of the solution.